Hello and welcome to the Roundtable Podcast. My name is Shogun. Joining me today for our formal debate series is Mr. Hermes, and we are going to be debating a very interesting and important and complicated topic, which is basically how society should treat or care for transgender children and youth. Specifically, we're going to debate, is it ethical to give medical transition treatments or interventions such as surgery, cross-sex hormones, or puberty blockers to people under the age of 18, or is that unethical? And so Hermes is going to be arguing that it's ethical to provide those kind of interventions. I'm going to be arguing the opposite case. That being said, please make sure you've joined the Roundtable Discord server. Check out hashtag announcements for all our daily upcoming events, and check out hashtag RT Podcasts for hundreds and hundreds of great episodes on YouTube and BitChute. All of our channels, of which there are 4, have unique episodes, so please like, follow, and subscribe to all of them. That being said, welcome Hermes. Thank you for joining me. How are you, my friend?
I'm doing good, thank you. All right, so since the argument is about whether or not this is ethical, I think we should start with whether or not it is, beneficial or not, whether it's harmful or not. And of course, we have to weigh the costs and the benefits, and we have to consider the pool of people that are affected by it, and basically select the option that brings about the best health outcome in the individual. So if I am to do what is most ethical, I want to maximize the health of the patient.
So, I'm sorry, but I'm unclear now. Have you started your turn? Because the moderator
yes.
has to, he has to tell you when you start, so he knows when to start the
So
timer.
I paused for when Shogun cut in. You've been talking for about 20 seconds. Sorry, I didn't, jump in there.
No, I just, for the structure of it, it should go, moderator should say round 1 begin, and that indicates when the speaker starts and when the timer starts and all that. So I was confused because I thought you were just introducing why you were going to go first. I didn't realize we'd started the timer. So I apologize, but what you want to do now is up to you. You can just continue, I guess. My bad.
All right, go ahead, Hermes.
All right, so first thing that I'm gonna point out is that the idea that this is some sort of violations of a child of their consent, or they can't give consent, and this is some sort of unethical thing because they can't give consent, is on its face factually false. Why? Because adults are involved in this, specifically the parents up to the age of I think 16, whereas at that point the practitioner, following the best guidelines, of course, will then have a long and arduous process where they basically assess if the individual has gender dysphoria, and if they do, if it's persistent or desistent, they assess if you have other coexisting psychological, medical, or social problems that can interfere with treatment, and of course the adolescent has given informed consent. So at the age of 16 or whatever, you still need to give consent. And this is actually true for all sorts of medical procedures for children. So the reason why this is highlighted is because a lot of people think this is some sort of frivolous cosmetic surgery rather than one that's designed to maximize the health of the individual and treat an actual disorder. That's why the idea of the consent is brought up, when in actuality there are a myriad of adults involved in this that are sworn to act in your best interest, following the best guidelines from the most reputable organizations, following thousands of studies with hundreds of thousands of participants in it, and all of them have basically, well, not all of them, sorry, the vast majority have revealed that puberty blockers are, in fact, a positive thing to do. Of course, there are most long-term studies ask, or at the end of the conclusion say, more evidence is needed, but the current evidence suggests that it is really, really, really positive, and actually lowers suicidality and basically treats gender dysphoria. So it's important to also realize that for an adolescent, you have to demonstrate a long-lasting and intense pattern of gender nonconformity or gender dysphoria. Also, you need to make sure that gender dysphoria has emerged or worsened with the onset of puberty. Okay, and then yeah, that was it. So then the question is, what are what justifies the intervention? The treatment. All right, so here is according to a lot of the stuff that I posted in podcast text. Sorry. 2 goals justify intervention with puberty-suppressing hormones. Their use gives adolescents more time to explore their gender nonconformity and other development issues, and their use may facilitate transition by preventing the development of sex characteristics that are difficult or impossible to reverse if adolescents continue on to pursue sex reassignments. Puberty suppression may continue for a few years, at which time a decision is made to either discontinue all hormone therapy or transition to a feminizing, masculinizing hormone regimen. So blockers in the vast majority of cases are given to adolescents to put a pause on the puberty due to the non-reversible characteristics that will cause severe gender dysphoria and severely increase the risk of that patient dying in the future and basically having a horrible life. So neither puberty, okay, so just real quick, withholding puberty blockers is not a neutral option. I have to just make that very clear. You are making a choice, whether it is to give or not to give. Both have consequences. You, as the practitioner, must follow these guidelines to make sure that the
30 seconds.
most positive outcome is reached for the patient. And also, last statement: the vast majority of children with gender dysphoria are not given puberty blockers. I think it's approximately 2%. So this proves that the selection process is highly effective at separating desistent dysphoria from persistent dysphoria. All right, done.
Yep, perfect time. All right, and so we have Shogun representing the other side. I'll start the timer. Take a deep breath. All right, go ahead.
Thank you very much. So I want to start with some grounding context for the discussion. Certain percentage of children, certain percentage of people, and therefore a certain percentage of children identify at some point in their life or believe they identify at some point in their life with the gender other than their natal or birth gender. This is kind of obvious, but this is what we're talking about, is how should you treat children when this occurs? So if you have someone under the age of 18, whether you're talking 4 years old or 14 years old, what should you do? How should parents, society, doctors, etc., treat these children in terms of policy and in terms of parenting? And should that involve medical intervention, meaning drugs, surgeries, hormones, or hormone blockers, or not? Now, my argument here is going to be that the treatment should, in almost every case, not involve medical interventions and should instead involve social, psychological, emotional, therapeutic interventions, things like counseling, therapy, also allowing the child to explore their gender identity freely. So you can allow them to dress as the opposite gender, provide them with the clothes that they want to wear, call them by the names that they want to wear, et cetera, et cetera. So I just want to clarify, I'm not arguing that children should not be encouraged in their chosen gender identity or that they shouldn't be able to explore it or that they should be stopped from transitioning. My argument is that they should be protected from interventions in their biological bodies through drugs or surgeries that can have irreversible effects, as I will argue and show. All of these treatments do have. None of these are fully reversible. All of them have permanent impacts, including puberty blockers. So that being said, why do I argue it's unethical? Well, first of all, this is just a basic continuation of well-understood moral principles that we have no problem applying in other contexts. So we do not allow children to engage in sexual activity, right? They're not considered old enough to consent to sex. That's why we have, age of consent and 18 plus laws. We don't allow them to drink alcohol, smoke cigarettes, vote, serve in the military, get tattoos, etc. All of this is because of a concept called age of majority, right? Which is to say that you're either you've reached your majority, you have free choice of these matters. Prior to that, you're in your minority because your brain is not considered developed enough, et cetera, to have a full context of these decisions. And so in order to protect children, even when they very sincerely think they want something, we don't allow them to do that in order to protect their long-term future, in some cases from themselves. So if your children said, well, I just desperately want a tattoo, you probably wouldn't go get them that tattoo, because you would understand that even though they want it very badly now, they might change their mind later. So you let them wait till they get older to make that decision for themselves when they can reasonably expect it to do so. So the basic grounding for this is that this principle generally applies in this case as well. Now, in order to steelman the opposite argument, I want to start by conceding one very important, which is that for that percentage of children, which we're going to find out in this discussion is relatively small, who are persisters, meaning they continue to want to transition into adulthood. Again, the majority of children who identify as transgender will naturally, quote unquote, grow out of it. So most children and youth who go through a phase of thinking that they're transgender, like up to 90%, according to many estimates, will ultimately re-identify with their birth gender naturally. So without receiving any, drugs or anything, they'll just grow out of it essentially. But for that small percentage of it that do not, they will end up being much more happy and successful in their chosen gender role if they were able to start transitioning before puberty, because obviously once you go through puberty, you acquire your primary and secondary sex characteristics, become fully developed. So you won't be able to pass nearly as effectively, right? So if you want to pass as a pretty girl, when you grow up, then yeah, you're going to wish that you started that transition as early as possible, like, before puberty. The problem with that, though, is that before puberty, you cannot give informed consent because you haven't even begun puberty. So by definition, in order to give the best possible outcome for that small percentage, like 1 in 10, who end up being
25 seconds.
You then have to accept the risk of transitioning people before they've even begun puberty, who by definition cannot provide informed consent, which is inherently unethical. And I'll yield my time.
All right. Is that working for you guys where I am calling out at the 30-second mark?
Yeah, that's exactly fine. 1 minute or 30 seconds, it's fine. It's just to give someone a time. But yeah.
All right. Well, let's move it back. Give a second to let all that information settle. All right, Hermes, take a deep breath and okay, you're on.
All right. So I'm just gonna go with the whole, children cannot give consent again, because I thought I already pointed out that's a false accusation, because this is not about children giving consent. It's about children receiving treatment that they do all the time. So I posted a example, general practice example for consent from something CA. And basically a 16-year-old saw a family physician for symptoms of severe depression. Speaking with the patient, the physician determined that the patient was mature enough to understand the seriousness of his symptoms and the need to address them. So keep in mind, there's an adult here, the adult, a trained adult, that's sworn by the Hippocratic Oath. All right, so anyways, the patient also requested that the physician not consult with his parents. The physician referred the patient to an adolescent day treatment program where he was followed by a psychiatrist. He was diagnosed with major depression and agoraphobia. After learning her child was undergoing treatment, the patient's mother filed a college complaint alleging that the family physician and psychiatrist did not obtain proper consent for a child to attend the treatment program. The college stated that by complying with the patient's request not to consult with the parents, both physicians acted in the best interest of the patient and in accordance to college practices. The point of this little mini example is that there are a myriad of cases where doctors perform treatment on people under the age of 18. You don't have to be above 18 to go to a doctor to receive treatment. That's just how it is. Most of the times your parents or guardian is present and will basically be part of the decision making. Of course, the key decision making is basically the qualified physician that assesses you. So it's not about what you believe, it's about an assessment of you. That's the whole point. So like if you think you have bipolar disorder and you go to a doctor and they're like, hell no, you don't have that. You're full of shit or whatever. Of course, they're not going to speak that way. But the point is, The entire purpose is to assess. And obviously, when we consider the fact that the vast majority of children taken to gender clinics, 90% or whatever, I think it was 98%, or 77%, it depends on what study you go with. The vast majority are basically kept at bay until they can qualify if the person has desisting or persisting dysphoria, and there are indicators for that too as well. So if you have severe gender dysphoria, there's a much higher likelihood of having persistent gender dysphoria. So the fact that a very small percentage of children actually receive the puberty blockers is proof of the checks and the eligibility criteria actually having a very significant effect, separating those that persist and desist very effectively. So there's that. Also, you point out irreversible effects. The more irreversible effect, vastly more irreversible effect, is the puberty itself. So the puberty blocker on its own has a few. It is generally considered reversible by medical literature, but it has a few minor irreversible effects, such as your penis might not grow that big. But keep in mind that only 2% of these individuals might desist afterwards. So that 98% is gaining the benefit of not going through the irreversible process of puberty. So 98% is benefiting from having a irreversible detrimental effect on them. They're avoiding that. Whereas 2% may have slight decrease in bone density, or sometimes have like smaller penis or whatever. But the point is the vast benefit mathematically, in every way, shape, or form, points to the benefits outweighing the costs in every way, with respect to the number of people affected by it and with respect to the severity of the effects. Also, I want to point out that the APA, the FDA, the AAP, Mayo Clinic, and basically all major medical institutions support and understand why puberty blockers are beneficial. Of course, I am not an expert. They are the experts.
20 seconds.
I have pointed out, I've posted a lot of references on the podcast text, so feel free to read it at your own time.
All right. So we had a lot of information there. You guys don't feel like I'm rushing you, right?
No, we have a time limit of 5 minutes. I would recommend giving a 1 minute warning rather than 20 or 30 seconds, though, just because it allows people to kind of formulate how they want to close the argument a little more fully. But that's
okay.
I know.
Yeah, that works. All right. Well, whenever you're ready, man, I'm going to say go.
Thank you. So many things to get into, but I do want to begin with the first thing about consent. So Hermes is saying, well, the consent thing doesn't apply, informed consent, because adults are involved. And I'm actually not satisfied by this. In fact, I think there's basically two things, because the whole point of this essentially is how do we protect children from harm? That's basically the goal that both Hermes and I are coming at this from. Everybody is coming at this of how do we help protect children from harm. Now, there's two ways that children can be harmed here. Well, three. One, they could be harmed by not having access to these treatments. Two, they could be harmed by having access to these treatments or being given them when they should not be or when it's not necessary. Now, in that case, it could be because the child themselves, impulsively or, in a state of immaturity or confusion or social pressure or whatever, thinks, this is the solution for me, makes this decision sincerely believing that that's what they want, but later, as has actually happened with many people, they look back and realize, oh shit, now I realize, I was depressed, or I was a lesbian, or I was gay, or whatever the issue is. I wasn't trans, I thought I was, and now I caused some kind of harm by going through this transition process, and now I regret it. And that does happen, right? It is a relatively minor percentage in the literature, but it still amounts to a lot of people who made a mistake, right? With all the best intentions, they thought they were trans, they later realized they weren't. And in many cases, they end up sterile, right? Unable to have children, which is a really significant thing, right? A lot of people later in life when you're kids, when you're young, you don't think you want to have kids. You don't think that matters to you, right? When you get older, suddenly for a lot of people, they realize that's the most important thing. So that kind of thing is where the really severe harm comes in. If you put people on drugs that end up with them becoming sterile later, blah, blah, blah. Now, that can happen again because the child makes that decision. That's why the parents that's why I'm saying we should protect them from that, because they're not mature enough to understand concepts like pregnancy. They're not old enough to understand sexuality. They're not old enough to understand gender or the life that they're actually leading. So therefore, it's reasonable to say they cannot meaningfully consent to this kind of treatment, and they may be making mistakes because of simple immaturity. I know for sure I did not understand everything that being a man or woman or parent entailed before I had begun puberty, and yet we're asking them to make decisions that are going to end up having permanent effects in virtually every case. Now you're saying, oh, but there's adults involved. That's the other problem, because I'm a sociologist by training, and I understand how this is not pure medicine. It's not pure science. This is where culture and sociology and ideology and policy intersect with human bodies and human lives. And the reason that matters so much in this case is these are children, so they're highly vulnerable to suggestion. They're highly vulnerable to subtle manipulation, whether benevolent, malevolent, or neutral. They are little sponges, and they believe what they're told, and they don't have the depth of understanding to make these decisions in an informed way. So they can end up becoming unwitting guinea pigs or unwitting victims of ideologies and movements that may have good intentions, but may end up down the road creating entire generations of people with sincere regrets, such as having gone through hysterectomies or having their uteruses removed or becoming sterile, or even, like you say, having a micropenis because they went on puberty blockers when they should have been going through puberty, right? So the problem here is also parents, as you know, right? As you know, parents can be abusive, they can be selfish, they can be stupid, they can be susceptible to the dumbest of things, right? So the sad fact is there are plenty of parents, and this is true, we all know this is true, who would literally subtly mindfuck into transitioning just to get more Instagram likes on their posts where they celebrate how brave they are for having a trans kid and being a trans parent. It's disgusting, but it's true. In the world we live in, people will use their children as accessories, and whether consciously or unconsciously manipulate them in various directions. And so we also need to protect the children from those very same adults and allow them to get older and make that decision for themselves. Because we may say the kid wants that, but how do you know that's what the kid wants if you're not there when the parents are influencing them, right? And how that influence is playing out. And you can say it's what the parents want, but again, it's the children's decision. They should make it when they're old enough to make that decision, right? You could make the same exact argument about child marriage. You could say, well, children aren't old enough to consent to marriage. And you say, yeah, but think of all the adults. The parents consented to the marriage, but it's not their marriage, right? They're not the ones who have to live with the biological changes that they're inflicting on the child. So even if the parents have the best intentions, well, the road to hell is paved with good intentions. So how do you avoid the child either screwing their own life up or being screwed up by the parents? You wait till they become adults and make decisions. Sorry.
No, it's all good. I think it works better that way. All right.
Good evening, boys and girls.
Good evening, Mr. Batman. We're just having a formal debate here, Hermes and I.
Oh, I'm sorry. I will bow out.
No worries. Thank you. You can listen.
Alrighty. Well, Hermes, just a few seconds. All right, and you're on.
All right. So I think, nobody is arguing that there aren't costs, The argument here is that the benefits vastly outweigh the costs. And I'll address all the sociological concerns that you brought. And the biggest, of course, parents can be insane. I'm all about getting the government involved into how parents treat their children, always. I'm a big fan of that. I think it's very important for institutions to check on the well-being of children all the time and make sure that these families that might have outdated beliefs don't, abuse their children and cause them further suffering. So, with that, being said, the check on the parents is the qualified physician. And as I said before, basically every single major institution supports it, and they're not doing it out of political reasons. They have studies for it. So while I understand there is a political atmosphere surrounding it, it is absolutely irrelevant to the science of the data. And let's see what else. Oh yeah, so with respect to regrets, vast majority, and I've posted I think 50, 60, 70 studies with books, you can look at it. Vast majority of studies point out that regret post-transition, after puberty is basically, what was it, like 2%? After HRT, I think it's less than 1%, and SRS, SRS, sex reassignment surgery, is also incredibly low in the single digits. And for the sex reassignment surgery, actually, the what do you call it? The risk factors has dropped significantly since treatment has improved. So medical practices and surgery has improved in quality. So a lot of the negative outcomes after SRS has been removed. Although I know we're not talking about that since those are not given to children. SRS is never given to children. HRT is sometimes given to very, very, very few children that go intensive assessment. So like, you know, if 2% get puberty blockers, like 1% of that 2%, you know, get the HRT. Like it's really, really rare exceptions. And I believe it has to do with like certain like biological problems with like imbalances in hormones, and they have to treat or something like that. Of course, this is done on a case-by-case basis to make sure everything is designed to maximize what is best for the child in these clinics. So really, I'm not even saying anything controversial. I'm just saying we should just understand that the medical consensus on this is not motivated by politics. Rather, it is motivated by the science. And I'm going to also, again, address the whole consent thing. This is very different than having sex or being married or anything like that. As I pointed out, children do get treatment from doctors before the age of 18 all the time for many, many procedures, all kinds of procedures. The problem why people think this is, you know, and also those can have complications too. Those have risks. Of course they do. Most surgeries have risks. Most medical procedures have risks. But most of the times people don't object to it. It doesn't raise alarm bells because the idea of, you know, puberty blockers, which is largely reversible, and HRT, which is partially reversible, is that this is some sort of frivolous type of cosmetic coddling of mentally ill people. Whereas when that's actually not the case, according to anyone that's educated in the field. However, there is this perception
55 seconds.
That is the case. And also the suicidality, which is the key, you know, one of the key factors here, because if you care about children, you would want to make policies that lead to the less dead children. I think that's a very uncontroversial statement. So given the numbers and given the statistics on lowering suicide, and I've posted myriad of them, and I've also pointed, I don't know if I've posted the counters for the fucking misrepresentations, but yeah, suicidality does go down. I'm done.
Alrighty, you have 15 seconds left if you can think of anything. You want to just leave it there? All right, that's fine. Whew. So, man, this is going back and forth is pretty crazy here for me. Like, well, that's why we do debates, right? So, awesome. All right, shooting it back over to you, Shogun, and you're on.
Thank you. So now that we've covered some of the basics, I want to go in this turn more in detail about why I oppose the practice of medical transitioning of minors in at least the majority of cases. I do want to make one more point about consent, though, just to rebut Hermes' point. So he's saying, well, this isn't a matter of consent. This is just a matter of receiving treatment. And obviously, you know, children don't need to consent to receive treatment in many other cases. If your child has appendicitis and your child says, no, don't cut me open, I don't want the surgery, obviously you're not going to say, oh, well, they didn't consent, let them die. Of course not. That'd be ridiculous, right? If there's a medical issue of that nature, biological, antibiotics, injury, bleeding, etc., obviously consent is assumed and implied and made by the parents. I don't question that. But if we're being honest, we have to admit that the transgender identity issue is not that kind of issue. This is a combination of complex emotional, social, cultural, psychological, identity, behavioral, and lifestyle choices and decisions that people make in a fluid environment that changes as they mature and go through stages of their life. So this is not equivalent to, oh, well, my child needs brain surgery, or, oh, my child's bleeding, they need stitches, right? So we can't pretend it's as simple as, oh, they're just receiving treatment. Sure, they're receiving treatment, but it's treatment for what is ultimately an emotional, psychological identity issue, however you want to look at that, and for which there are other alternatives available, et cetera, et cetera. So I just want to clarify that's not exactly an analogous situation, and other kinds of treatment could be attempted instead that would not biologically change that person or prevent them from going through natural developmental process. So that being said, okay, so first reason why I oppose medical intervention, because the children are not old enough or mature enough to understand the implications of a decision that will have permanent effects on them developmentally. Because regardless of if the puberty blockers themselves are reversible in the sense that you can discontinue them, what you cannot do is regain the lost developmental period of time. So the absence of development is itself permanent and not reversible, right? The fact that you can resume development when the drugs are stopped does not mean that not go through that development and experience the changes or lack of changes during that period of time, and therefore it's sort of facetious to call it reversible because it has permanent developmental effects, as you admit when you say, well, yeah, your penis is way smaller than it would have been. That's because it's not reversible. All you did was seed the drug and allow what natural process to try and catch up, but you can't get back to lost time, so it's irreversible in its effects. So again, the reason why is that the vast majority of children who identify as transgender will naturally re-identify as their birth gender. So therefore, it's fairly straightforward logic. If your child thinks that they are transgender, there's an overwhelming majority chance that they will later change their mind and re-identify with their birth gender. Therefore, the one thing you do not want to do is tamper in their biology, their neurology, or their physical body. What you want to do is allow them to explore these thoughts, talk about it with experts and psychiatrists, talk about it with parents and peers, try a different lifestyle, try wearing the clothes, try going by a different pronoun, try doing all those things as you develop and see if you like it and if you don't like it, and ultimately be prepared to make a choice when you're old enough and mature enough to do so, in the same way that we allow people to make other consequential choices when they reach an age of majority. What you do not want to do is take what is in the majority of cases a temporary and transient developmental crisis or gender identity crisis and lock it in artificially by chemically or biologically tampering in that person's body in a way that creates a self-fulfilling prophecy. Because if you give drugs to a boy that prevents his penis from growing and keeps him looking young and feminine, you are by definition, if you think about it logically,
1 minute,
decreasing the likelihood of him successfully reintegrating into his birth gender. Because if he ends up deciding he wants to be a boy, he's not going to want to be a boy with a tiny little penis. And if he is a boy with a tiny little penis, he's more likely to make the decision to transition into a woman. But that doesn't mean that was his natural choice, because now you biologically altered him, so he cannot make a free decision from his natural state of development as an adult because someone tampered in his body when he was still a child. And I'll yield my time.
All right. You had 30 seconds, just to let you know.
Okay, I'll use my remaining 30 seconds. So that being said, the mature thing to do, the responsible thing to do is provide education, support, therapy, counseling, resources, and identity exploration freely and in a supportive environment, but not do anything medically that will bias that child to making one decision or the other in a way that deprives him of his natural choice, or even influences it or constrains it biologically when it should be a psychological and social process.
And time. Awesome. Cool. Given some breathing room. Hermes, if you're ready, I'll give you a little heads. Let's go for it.
All right. So I'm gonna start with the refutation of like gender dysphoria not being like other disorders. So just because you can't see it, like an organ is not hanging from your stomach or whatever, it doesn't mean it's not real. Schizophrenia, bipolar, all of these things can be, you can say these are just socially constructed disorders. There are physiological changes and differences between those that have gender dysphoria. There has been studies, and the brain structure is actually different in most cases. It's not exactly like a woman, but it's not exactly like a man. It's weird. And of course, there are various factors for that. One of the factors is prenatal exposure to hormones. So that's why some people have that issue. So just want to make sure this is a very serious disorder, and I'm gonna read a little bit from Mayo Clinic so we can all understand a little bit more. So gender dysphoria is a diagnosis listed in the Diagnostic and Statistical Manual of Mental Disorders, the DSM-5, a manual published by the American Psychiatric Association to diagnose mental conditions. This term is intended to be more descriptive than the one that was previously used, gender identity disorder. The term gender dysphoria focuses on one's discomfort as the problem rather than the identity. A diagnosis for gender dysphoria was created to help people get the necessary health care and effective treatment. So there are, let me see for diagnosis and treatment, what you need. But in the meantime, while I find that, I just want to point out again, if the purpose of this is to minimize harm, then what Shogun said about the whole exploration thing is actually true, and that happens, right? So most of these clinicians have like year, 2 year or whatever follow-up to make sure that you do explore, you're educated, you are taught and allowed to live your life, in specific ways, and then you're assessed by professionals to see if you will desist or not. And as was previously pointed out, this is very effective at screening people. So it is true that a lot of people desist, but the people that pass the screening, the vast majority persist, like 98%. So we need to focus on that because that's where the issue really is. So if 2%, right? Let's just say 2%, right, were to die, all right? And this is not even the case, right? But I'm just going to go extreme. Let's say 2% dies and 98% basically has a far, far, far better outlook at life. They won't get depressed. They won't get into drugs. They won't commit suicide. They won't do all that, whatever. So, or they will have a lower chances of doing that. Obviously, I'm exaggerating that 2% don't die. Of that 2%, not all of them, get those complications with the penis size or whatever. And you do actually resume growth. That's why the medical literature, again, I'm not an expert, but the medical literature from places like the APA, at the top of the top, do actually point out that puberty blockers are reversible and effective for treating dysphoria. And the general purpose of it actually isn't to permanently change the body. The purpose is to give more time for further assessment, which is the most responsible decision that can be done, which is why every major medical institution with the greatest number of checks and balances, to make sure everything is done the right, not checks and balances, sorry, eligibility criteria to make sure that everything is gone through nice and smooth. So here are, and I think I've pointed this out, but the World Professional Association for Transgender Health provides the following criteria for hormone and
1 minute.
surgical treatment. So persistent, well-documented dysphoria. So that means that the desisters, are basically screened out from this. Capacity to make full informed decision and consent to treatment. So you still even even as like a 16-year-old, you still have, or a 15-year-old or 14-year-old, you still have to say yes, and you have to be, cognizant. And of course, in many cases, you have a parent, and more importantly, you have the professional following best medical practices and best guidelines. So, I mean, I'm not even an expert on this, but I mean, all the studies seem to point out towards it being vastly beneficial.
10 seconds. Alrighty, if you're yielding, that's cool. It sounds like we have the narrowing down that this could be a transitory existential thing versus they are physiological and rooted in extensive research and literature. So Very cool. All right. Shooting it back to Shogun.
Yeah, and sorry, is this our third round now?
I'm trying to keep track. Let's see. 1, 2, 3, 4. No, we've gone way more than 3. I think this is about to be the end of the 5th one.
No, we haven't done 5 rounds. We're talking each set of 2 is 1 round, right? So it goes 1, 1, 2, 2, 3, 3. I believe. Do you know how many turns you've had, Hermes?
I think I've had 3 turns, so probably you're on the 4th. I think. I'm not sure.
But you went first, which would mean if you've had 3 turns, this is the beginning of my 3rd turn, which I think is correct.
Yeah, you're right. I did go first.
Yeah. So this is the end of round 3. Okay. So ready, moderator?
Yeah. Go ahead.
Okay. So I'm just trying to remember where we left off. So I guess I'll just start by pointing out this thing, right? So we have a little bit of an analysis of data question here. So we're saying, okay, yeah, 80 to 90% of transgender children will re-identify naturally with their birth gender without receiving or needing any treatments. But of those who go on to receive puberty blockers, only a minuscule percent, 2%, end up into detransition. Now, the argument, the analysis of this that Hermes is presenting is that indicates how good the screening is, so that of those who received it, it was 98% accurate that they were the ones who really needed it. I'm going to argue that this is not necessarily the case, and you might actually be seeing something kind of sinister here. What I see there is the evidence that once you give a child puberty blockers and you interfere with his natural pubertal development, you greatly harm his chances of achieving the optimal result. The optimal result for the well-being of the child is that he re-identifies with his or her natural birth gender in a natural way, as most of his cohorts will, because although obviously, you know, we want to support those for whom that's not an option, that is ultimately overwhelmingly the most positive outcome that can happen for these children. I would argue this statistic gives you evidence that once you administer the puberty blockers, it's basically a point of no return. And because of the complex biological and social and psychological effects of that, you're basically reducing the child's chance of successfully reintegrating with their birth gender to near zero. Because again, if you don't develop naturally as a man through puberty, you're very unlikely to look at yourself in the mirror and say, yeah, I'm going to be a guy, because you haven't developed in that way. And so you're more likely then to make the decision to continue, as 98% of them do, sex hormones, which then you become physiologically dependent on, and which render you sterile, which deprives you of your chance to have children, which is a very significant physical consequence, regardless of whether any individual person ultimately decides to have children or not. From a medical point of view, sterility and infertility are pretty severe side effects. So by definition, we want to avoid causing sterility or infertility or dependence in children if it's not necessary. And in the majority of cases, untreated transgender people go back to successfully integrating with their gender. So I'm just going to propose that maybe this is actually showing you how harmful puberty blockers are, in that they greatly reduce the successful reintegration. It's a self-fulfilling prophecy would be something of my argument here. And then also what's pointed out is when you go through puberty, it's not just about whether you develop male or female sex characteristics. It's a pivotal developmental phase in your life. That's the phase when you start dating, you start having sex, you start learning about your gender and your sexuality. The problem is if you give children pre-puberty a pubertal blockade, aka puberty blockers, they will not experience lust in a natural way. They won't experience sexual desire in a natural way because they're not having those hormones that fuel adolescent sexual experimentation, and therefore the natural and healthy development of gender and sexual identity. So these children are essentially being deprived in order to prevent them from going through their physical development. They're also being stunted psychologically, socially, and emotionally by being kept physically in a childlike state when their peers are progressing into adulthood. This, by definition, alters that they're playing with in a way that constrains their further choice in the future. So in order to allow them the maximum degree of autonomous sovereign choice, we want to preserve their decision-making and not limit their choices because of the outcomes of the interventions we've given them. because that will artificially potentially create a self-reinforcing cycle of sorts. And again, it's very difficult for anybody to understand how important to them childbearing or parenthood will be, because as I've experienced, right, when I was young, I didn't care about kids. Now that I'm older, it becomes increasingly important. And for many people, it becomes an overwhelming existential urge. So protecting that decision-making ability in people until they can make that choice, rather than rendering children or young adults sterile for what's most likely a transient gender identity crisis, is putting them at risk of permanent irreversible harms for a condition that in many cases is not permanent, and that's being transgender itself, because indeed not everybody is the pure form of transgender, which you can point to neurologically, and that's what I'm going to have to get into in the next round as regards socialization and the risk of what's been called somewhat unfortunately
time.
Thank you.
Yeah, you were pretty much wrapping that up anyways. It was all right. Hermes?
Sure.
Let's go.
So the thing about, puberty blockers being harmful is in direct contradiction with the Endocrine Society and the World Professional Association for Transgender Health that support the use of puberty blockers for kids who want to delay or prevent unwanted physical changes. Also, the U.S. Food and Drug Administration has approved puberty blockers for children. Also, the sterility claim is not true. Actually, you can definitely still reproduce after blockers. That's why it's not listed as one of the effects. I'm not sure if there are surgeries that you can, increase your penis size or whatever. For the 2% that have to suffer from that, I'm sure there are workarounds. And if there aren't, they can get all sorts of other treatments, but they can still have kids. Unless they go on HRT, which they do as an adult. And the absolute vast, like 99.99 whatever percentage of the cases, HRT is only for adults. Blockers is almost always for adolescents. So by the time they have reached the age where they can, either stop puberty blockers and go on HRT, they're an adult and they're making an informed consenting decision to make sure they go sterile and live the life they want to. So there is that. But I want this to be understood by people. Imagine for a second, right? You had a daughter and she was like 20 something. She was really pretty or whatever. And the next day she starts like growing beard, her like stubble, and she's growing, like her shoulders are getting bigger and her voice is getting coarse and all that is happening. How would you feel if that was happening to, and I am in this case appealing to emotion because I think it's necessary since I've gone over all the data. How would you feel if that was, you don't have to answer right now, if that happened to your daughter? Can you imagine the torment that she would go through? That is very easy to understand when you think about it from a woman, but from a guy's perspective, I'm sorry, not guy, oh my God, I'm so sorry. For a trans female, that's not really considered because there is this underlying assumption that it's fake. And that the harm isn't really a big deal. Also, I need to point out that there's a clear difference between those that this is the before being given blockers and after it. So there's a reason, right, that waiting period is done, and the vast majority drop before the blockers are given. It's really important to understand the eligibility criteria does not give that treatment to the majority. It gives it to a very small minority. And those small minority have shown characteristics that differentiated themselves from the majority that did desist, including having a very persistent GD and other factors. I'm sure this is done on a case-by-case basis after all, over a long period of time. It is not at all some easy thing to do. That's completely a misrepresentation of the actual reality concerning the checks with respect to receiving puberty blockers. What else? Physiological changes, dysphoria. Yeah, I mean, I think I've covered the majority, but I do want to go over this study. I just wish I could find it. Oh God, I've got like a million tabs open.
You still got a minute and 10 seconds.
Okay, I'm gonna take like a couple seconds to find it.
Cue the elevator music.
Oh yeah, I found it. Okay, so this is done by cornell.edu. It has like 55 studies plus an additional 17 studies. And out of these 72 studies, let's see, what was it? 93 found that gender transition improves the overall well-being of transgender people, while 4% of the studies, 93, really good, 4% reported mixed or null findings, while not a single one concluded that gender transition causes overall harm. And if your argument is that, the vast majority of, people after receiving puberty blockers go on to take HRT, as adults, that is also a beneficial thing. The outcome of their mental health and their life, their quality of life has significantly increased. And this is a really, really comprehensive one. It's called What We Know, inequality.cornell.edu, with really, really large collection of
And
studies.
time.
I'm done.
Sorry, I muted myself. That's a lot of data. All right, Shogun bringing in the second half of the fourth round. And take it away. Making sure you can hear me. You guys there?
I can hear you.
All right, Shogun, are you with us? Oops. Okay. Just gonna send him a quick message.
Cue the elevator music.
Cue the elevator. Yeah.
Oh, well, it seems there's some technical issue with Shogun. Yeah, he's gone the detained role for some reason. Can
Okay.
Sheikah fix that?
I'll fix it.
Thank you.
The bots are taking your side.
This is the deep state trying to silence.
Done.
Thank you. Apparently, I posted too many sources too quickly in the podcast text channel and I got detained. I apologize. I have started to post some sources there and I'll continue to do so if anyone wants to check those out. But yeah, sorry.
No, you're good. That's just funny.
Yeah.
All right, bringing in the end of the fourth round, Shogun, take it away.
Okay, so in this round, I want to go a little bit broader. I want to keep it on topic to the issue of minors, but I think it's necessary to talk about the broader sociological issue here. So in recent times, okay, so pure transgenderism, if you want to use that term, problematic though it is what Hermes is talking about. It's persistent, lifelong gender identity dysphoria, body dysmorphia, gender identity disorder, whatever you want to call it, right? And it may even be, in some cases, corresponding to some kind of biological difference in the brain that can be observed. However, if you look at the statistics, in recent years, the rates of people, specifically teenage girls, as the overwhelming example, but all demographics, who identify as transgender has skyrocketed to the tune of like thousands of percent. It's like in some places it's like, many hundreds of percents, right? That is increased many times over. Now the problem is the percentage of people who actually have this, pure form, gender dysmorphia, gender identity disorder, body dysmorphia complex that we might want to call that experience of being, trapped in the wrong body, is only like less than 1% according to all of our estimates, and yet the percentage of people identifying in youth and adolescence with transgender identity is skyrocketing, and we're also observing that this tends to cluster. So if there's one youth in a high school class who transitions, we notice a phenomenon which unfortunately is called social contagion, not because it's a disease, but because of the way it's spreading in a way that's similar to the way infectious disease spreads in clusters, right? this is what we observe. Now, obviously, we know that actual gender identity disorder, that what Hermes is talking about, this sort of biological form, would not spread in that way. So therefore, what you're actually seeing is monkey see, monkey do, cultural transmission, social transmission. You're seeing people being influenced by peer pressure and having a reciprocal interaction with their cultural and social environment. In other words, what's being presented to them is a lifestyle. It is an identity which has many things that entice people other than that they're trapped in the wrong body. They want to, whether consciously or not, especially young girls, they want to be like their friends. They want to fit in. They want to stand out. They want to provoke. They want to have special privileges, whatever. Now, nobody's denying that that's not all transgender people. But even transgender people that I know, they use the term trans-trenders to represent how in modern times, a lot of people who don't have any of these traditional long-term disorders, whatever, are influenced by this. So why does this matter? Well, it matters precisely because the age demographic that's most susceptible to this kind of social transmission are adolescents. They're children, especially young girls, and those are the ones who are making these decisions, and those are the ones who are beginning a transitionary process which can end up having lifelong effects. So this is why this is not an ideal time for these kind of decisions to be made in a medical sense. They should instead, in most cases, be playing out simply in a social sense. And when you look at, so you're saying, well, you know, puberty blockers don't render you sterile. As far as I know, that may be true. The point is, though, that the vast majority of people who are put on puberty blockers go on to continue to take the hormones, and that's what can make you sterile. And there are indeed, if you look at the regret literature, many people who say, looking back, I was a lesbian, right? And I didn't understand that I was lesbian. I was young, and there was these gender identity coaches and experts, right, who are, whether they like it or not, often biased by their academic discipline, right, which will change over time as it has changed to now, as this, evolving science grows. So the point is, people can become victims of ideologies, including medical and psychological ideologies. And I can tell you, psychiatry is far from a hard science. Psychiatry is far from a hard science. So the point here is, in many, many cases, what's happening here is young homosexual, bisexual, effeminate boys or masculine girls, lesbians, etc., are coming into a interventionary regime, which is informed by an academic and scientific milieu, which can then influence them in a way that may be unconscious but powerful into pursuing identities that are different than what you might call their natural destiny, which probably would have been to develop into a well-adjusted homosexual or bisexual who would actually have much better social outcomes in many cases than even fully transitioned transgender people, who often continue to experience profound issues, including suicide, even after receiving surgery and everything else, which is another issue that I guess I'll have to get into in the last round.
5 seconds.
Thank you.
And time. All right, that was an excellent round. And we're starting the 5th round. Just take a second, prepare your thoughts, Hermes. All right, you're on.
All right. So I will, obviously acknowledge that there is a social phenomenon, although it's not nefarious. I would not call it nefarious. But there is a social phenomenon that is happening right now. However, the vast increase of people, identifying as transgenders and, of course, receiving treatment, although that's far, far less, is, could be to multiple factors. Of course, there are some that could just be riding some sort of weird wave, I guess. I don't know, kind of like just kids, just going on a fad or whatever. And that's the whole purpose of the whole, eligibility criteria, is to separate those two. And the what is it called? The social exposure, or the social exploration, and the social treatment comes obviously before the medical one. In fact, the social always precedes the medical. And after a long-term social type treatment, it then proceeds into more like direct medical intervention of kinds. Most specifically puberty blockers, like the vast majority, and that is given to a very small percentage. Also, the decision they make for going on to HRT after, they reach adulthood or whatever is when they can give consent. And you could say, oh, well, being in that state made them less likely to give informed consent. I mean, you can make that argument for anything. It environment affects everyone. Of course, this was done with the best practices and under professional guidance over an extended period of time, allowing the child to explore themselves and to make sure they grow out of the fad, if it is a fad, and receive the treatment they need to make sure they live more healthier lives. Also, for the children that become adults and then decide to go on HRT, as I've pointed out from that massive study, the vast majority point out that there is benefits to the treatment. And I'm not a doctor, actually. Biology is my weakest subject, but I do like psychology. So I don't know what else to say. LGBTQ suicide rates. I think in order to compare, you were saying that if someone just were gay and lived a gay life, that would be better. If they were actually gay and don't have gender dysphoria, I absolutely agree with you. If they don't have persistent dysphoria, I think Shogun is getting detained all the time, and I'm not seeing his post. Sorry, this is like a intervention thing. He got detained again, and I'm not even seeing his post in the podcast text.
Okay, I'll take care of it. I got it.
This is a good time to wrap things up, guys.
Yeah. I'll end it soon. So, in that study that I pointed out, the one from Cornell.edu, it's not a study; it's a comprehensive meta-analysis, basically. And yeah, those pointed out that there is benefits for transition. So, after getting the puberty blockers, going on HRT after they know they have persistent dysphoria is making the best medical decision. It's literally based on all evidence, which is why I suspect these medical institutions actually basically all universally agree, as a whole, that treatment is the best way to go about it to make sure less children are harmed. Do I have time left?
Yeah, you still have a minute left.
Okay. Let's see. Transgender requirements. Oh yeah, so the skyrocketing thing, I just want to address that real quick again. One of the factors for that could be that there were a lot of people that were transgender that didn't realize it, and after being exposed to the literature, they realized more about themselves. Or there could be a lot of people that were in the closet that after societal changes allowed them to be more comfortable with themselves and come out, basically. Pretty sure that can account for a massive increase in numbers. As something becomes more socially acceptable, it's just more likely for people to be less afraid to come about and express themselves. So yeah, I think I'm done.
All right, you yielded at 20 seconds, just to let you know, for your own, to gauge your own, how you use your time. So let's see, let's check if Shogun's with us.
Yeah, I'm here. Sorry, I keep getting detained for spamming sources. I guess I got to do it more slowly.
You're just too good with those sources. All right, man. Let's finish the 5th round. Are we going to be done after this one, or are we going to keep going?
There's 5 rounds.
Not really traditionally.
There's 5 rounds for the debate, and then after the debate, we open it up for audience questions and participation and feedback. And traditionally in the past, we would make 2 straw polls, one saying, who do you think did a better job debating? And the other one saying, who did you agree with? Now, I don't know if anyone wants to do that, but yeah, we'll do that part after. So anyways, this is the end of the debate phase, and then we open it up to audience.
All right, cool, man. Well, just give you 5 seconds to get ready, and let's go.
Okay. So I guess in this round, I just want to sort of clarify my position a little bit. I don't necessarily take the point of view that, these kind of treatments should be banned 100% of the time in all cases, right? That's my actual position is not necessarily that extreme. I could imagine that there would be some cases where this might be the right course of action. My position here is more general, which is to say that, we should generally apply the precautionary principle, which is that, if a given intervention has a risk of causing harm, then generally speaking, we should not engage in it. I didn't necessarily explain that properly, right? But the point is we want to make sure our intervention is not itself doing harm, and we want to respect general principles of informed consent, and we want to recognize that, at the end of the day, we all understand that when we were young children, such as you would necessarily be before you gain puberty, your grasp of things like gender, sexuality, parenthood, etc., are necessarily not even close to developed or mature, and yet it's only on the basis of that understanding that you're making this decision. So this is a reiteration of sort of the fundamental problem, which we can all understand, of making these kind of decisions too early in a way that might have permanent or semi-permanent effects. But I'm not saying it should be 100% banned in all cases. I would say there has to be, and I want to point out there has been professional legal analysis of this, and that legal analysis did conclude that children cannot consent to this, and that led to an immediate cessation of these treatments at the time. And since then, there's been a whole political battle. But what I'm saying was actually agreed to by legal experts who looked at it. They said legally, the children cannot consent to this. And so that's the basic part of it there. So my point here is basically just that, given that this is a question of identity, lifestyle, gender, and sexuality, the overwhelming treatment option should always be counseling, therapy, psychology, experimentation, maturity, and because the vast majority of people will grow out of it naturally, therefore I think a hands-off kind of approach makes the most sense, because most people will proceed through it. Kind of repeating myself here, I do want to, I guess, wrap up by conceding that, like, even when I was doing the research to prepare for this debate, it was already clear to me that there's a very strong counter argument, right? Which is, again, the very low reported rates of regret among people who transition. It's very low. It still adds up to a lot of people, and their suffering can be very profound who do regret it. But statistically, they're a small minority, and the evidence about, better long-term psychological outcomes or lower suicide rates for people who transition, and the unquestionable fact that for those who do persist, their aesthetic and therefore social and emotional outcomes will be exponentially better if they start this transition early. So I can't contest any of those points, right? All I can do is try to offer the counterpoint. And I guess the big cautionary lesson and the purpose of me doing so, of playing devil's advocate, if you want to say so, is because what does seem clear to me is there is a social phenomenon here. It is a form of social contagion. It is a trending and increasingly fashionable ideology. Children are an identity, not ideology in this case, but identity or lifestyle. And children are highly influenceable. And also this technology and these treatments are relatively new, so the long-term data, there are definitely people already in their 80s and so forth who transition. But the point is, this is still sort of experimental. These new generations of kids who are starting these transitions earlier and earlier, going through more and more aggressive or more and more complete transition processes, we don't really know what their long-term outcomes are going to be, or what the long ramifications will be. And in a world where, the rates of children identifying with this are skyrocketing to the thousands of %, I think we need to definitely be careful about taking the point of view that if your child identifies this way, even if quote unquote gender experts agree with them or encourage this, we have to be careful that we're not creating rather than treating transgender children. And I think to a very large extent, it's obvious we are creating transgender children probably more often at this point than we're treating them. That's just evidenced by the unlikelihood of a biological or genetic condition exploding in prevalence the way the transgender identity is. So if we start medically treating people who are responding to a social phenomenon like a trend or a fad, I think that's fundamentally wrong-headed. Again, obviously they have ways of assessing this, and as Hermes says, perhaps they're doing a very good job. I would just argue that a much more desirable outcome is to encourage and allow children to naturally re-identify with their gender. And for those who simply, thank you. Great. Thank you so much for moderating. Lava, thank you so much for the debate, Hermes. And thank you so much to everybody in the audience who listened. So we're going to open it up now for questions and answers or comments. But if anyone does know how to create a straw poll and wants to create those polls, please do so. Otherwise, we can resort to an old-fashioned emoji reaction poll if we want to do that.
I just want to let everybody know I created a straw poll in the general chat. So if you'd want to put something in there, you totally can. I put 2. So you just click the link and you can do it.
Thank you. So does anyone have any questions or comments based on the debate?
Yeah, I actually have a question for Hermes.
Sure.
So, I think it was the third round where you mentioned the DSM-5 and the APA, and I'm curious as how do you weigh that against social and spiritual, like, I guess, pillars of thought, like we have the way that the research shows a picture, and then we have like value judgments of what we think like a good life is, and like how do you balance those out in terms of how you support this? And does that make sense?
Yeah. I mean, I do think there are metrics that we can use to, like evaluate what the quality of life is, over a long time. I think those are called longitudinal studies. I mean, yeah, that you can definitely, assess objectively based on a metric how well someone is doing afterwards. I also want to answer something that Shogun said real quick. I'm all for the improvement of the screening procedure even further, and as many studies have pointed out, more data is needed. So over that issue, there's no disagreement. And I honestly don't know how to balance the for the spiritual aspect, I mean, just having, therapy, care, or love from family, being accepted rather than rejected or assume that you're lying or that you're disgusting or that you're a predator because you want to use a bathroom without being harassed or anything like that. I think it's, yeah, just be human.
Yeah, I mean, I guess my basic point here is sort of this. Humanity has existed obviously for a long time, and it has developed into certain social forms, including like gender expression pathways that, generally speaking, this will be controversial, have been sort of adequate. They've manifested in particular ways through time. And again, that generally means, heterosexuality or homosexuality, bisexuality, or some variation of that, including, cross-dressing and all those things that people have always done. But today,
sorry,
I was just going to say today, because of the biological treatments that are being made available, they're creating a new avenue that essentially didn't exist before, which is to become a biologically modified person who is artificially altered beginning before puberty in a process that begins in childhood and continues into adulthood and lifelong, which creates new forms, which are these feminized males or masculinized females, which we call transgender people. So the problem is you can call it the treatment of a disorder, but realistically, it's actually the creation of a new gender expression or a new sexual identity and lifestyle. And the problem is that children are being on-ramped into that new lifestyle at a time when they are indeed children, and they're being put into a system which includes an ideology, a justification, a narrative, all kinds of subtle, inducements. Ultimately, they are various forms of inducements available here. And so my concern is, again, for every one, miserable transgender person who, and when I say miserable, I mean they were miserable because they felt trapped in the wrong body. For each one of them who encounters like a way better outcome than they could have otherwise without the treatment, I'm concerned you're going to end up with 3, 4, or 5 people who would have just been gay or lesbian or just re-identified, who have now been on-ramped into a system. And because of things like sunk cost fallacy and the way that you're bouncing around other people who are involved in this same concept, celebrating you, encouraging you, supporting you, that's great, but it also creates an emotional commitment, right? If all these people are celebrating you, you're less likely to change your mind because you feel like you'd be letting them down, or you've now put all these eggs in this identity basket and you don't want to look like foolish for changing your mind or thinking it was just a phase. And so you end up with an exploding number of people who are doing this. The problem being a lot of them are going to end up sterile and therefore forfeiting things like parenthood that they otherwise would have had.
Interesting. Yeah.
I know that's taking like another unofficial turn, but nobody was asking any questions or anything. So.
Well, I actually wanted to ask both of you a question to see sort of like how you cradle each other's cares. But before that, I just want to say to the audience, if you are voting right now, could you please vote for both, just so that we can get an even representation of the data,
Yeah, there's two polls there. Again, one of them is just who do you think did a better job as a debater, even if you disagreed with them. So again, if you totally disagree with my position, but you think I did better, you'd vote for me. Even if you hate Hermes' position, but you think he argued it really well, you'd vote for him. And similarly, in the other poll, it's just who did you agree with, even if the person did a terrible job, but you might agree with their position. It should be clear,
Yeah.
but if everyone can vote on both, that'd be interesting. We used to do one in the polls, which was a third poll, which was did listening to this debate change your mind, one way or the other. But we don't have to do that.
Where do we vote? Where is it?
In the general chat, if you scroll up, there's straw polls posted by member Buns, and you can vote there simply by clicking on it. Thank you, Buns. And I guess, Buns, if you do want to create that third poll, you feel free.
If no one else has any questions, right this second. Basically, yeah, go before me. Go ahead.
No, but ask your question.
I have two questions, one for each of them. Yeah. If we have time.
Moderators questions, and then we'll go to Blindy.
Okay. All right. Sure thing. So for you, Shogun, the question, the information about like the basis of the research based on like the psychological designations, how they assign different, how they ascertain the situation for the child, what that's based on in terms of the literature. What do you know about that, or if you know anything about that, what is like something that we could read,
I mean, I posted the criteria.
No, right. No, but I'm curious. Just curious about Shogun's like, when he interacts with that side of your argument, does he go in depth in terms of his understanding of it, or is it something that he is sort of like is not something he's really entertaining very much? Does that make sense?
Was that question addressed to me?
Yeah. So it's about the DSM-5 and the APA. Like, do you know anything about that research? How do you interact with that side of his argument?
The DSM research about how to treat this condition or whatever?
Yeah, like how to size up a child and figure out whether, they need this or that. Like, have you read any of those, articles?
No, I haven't read anything in any kind of extensive detail. I won't pretend that I have. But again, Hermes' position, and it should be understood, is the consensus. It's the orthodoxy, right? My position here is just pissing into the wind. This issue has already been decided, right? Society has already decided that gender affirmative treatment is the way to go. So gender affirmative treatment, meaning the way that a child identifies, you affirm that using medical interventions, and that's now become the orthodoxy, and that's the direction society has decided to go. The alternative position, though, and the one that I basically am sort of, at least advocating here, is it's called like watchful waiting, basically, which is just, be supportive, observe the child, allow them to develop, and wait and see which way they ultimately decide to go through their own natural process of interaction with society and themselves. So I'm just pointing out that, all the weight of evidence, if you really break it down, is definitely on Hermes' side. And to be perfectly honest, I'm basically convinced by his argument, right? So even though I'm arguing the opposite point of view here, assuming again that the standards are strict enough in terms of how they're selecting who actually uses these treatments, and if the evidence is all valid that only a tiny percentage of these people regret it and that they experience better mental and social outcomes, then from a policy point of view, his position is correct, right? So all I can really do is challenge it to see, how well the counterpoints hold up. But obviously, there's a reason that the scientific orthodoxy has gone the way that they have. And although I do think there has been a lot of sort of weird, subversive academic and political lobbying, maneuvering, and so forth, which becomes part of like a bigger discussion when it comes to this issue of like childhood outcomes, I don't suspect that this is all fabricated, right? This evidence is ultimately valid. And if it is saving people's lives and letting people be happier, then obviously I'm not there to stand in the way. It's just a debate. And I thought it was a really good one.
Yeah, no, actually, that's the thing, is that that's a good way to look at it. But also, there may be some people who don't necessarily agree with the concept of psychological evaluation based off of the lineage of that particular literature. So even if their research is all true, it's true based off of evaluative like principles and semantics that are rooted in a particular lineage, which may not necessarily, have anything to do with the research itself, right? And so we can have different ways to looking at it. And so the fact that you haven't read it, I don't think it necessarily discredits you. It's just that could be an avenue of introspection. You don't have to throw away the science. You can attack some of the foundational principles, if you end up looking into that. And so that's just to add a little bit more to the conversation. That's why I asked the question. Is it okay if we turn it over to Hermes for one question?
Certainly okay with me.
All right. So for Hermes, that's why I'm asking this, is to see how you guys are cradling each other's some of the root concerns. So for this, for Hermes, so the sexual issues, the issues of growth, in terms of the lack of development, there was a critical nuance that you both didn't agree on, which was the having a micro penis, right? Whereas for you, some of those anecdotal situations are basically, you're saying that that constitutes a reversible situation, right? So then it comes to see how you look at that on your personal life, how this would have affected you if you were in a position where you you had a micro problem. I'm even gonna try and give an example. I'm sure you get what I mean. So how do you interact with that side of his argument? Have you thought about that? Do you know anyone in your life who deals with those kinds of issues, or that you've seen an example as a result of this?
Yeah, I've definitely not met anyone that, has gone through puberty blockers and is now facing that particular issue. But I definitely think we should, consider that as a serious concern regardless. And I think, one way to go about that is to improve the screening process. And another way to go about that is increase the advancement of medical science, with respect to surgery. So the small percentage of people that end up with that outcome will be able to have corrective surgery, basically, to compensate for that. I mean, I think that's potentially possible, if not maybe already possible. I don't know. I do know for the bone thing, there is usually exercise, calcium, supplements, and many other things given on the side to kind of counter the bone density issue. Also, if I remember correctly, I think estrogen, which you get afterwards, does increase bone density, actually. But I'm not 100% certain of that yet. I'm pretty sure I went over the study before, but I haven't in the past couple days. So double check for that.
Alrighty. So yeah, that was basically it for my questions. You can turn it over.
Can I?
Blind, go ahead, Blindy. Go ahead.
Okay, sorry, you said a word. I thought you named someone else.
No.
So he was saying. Not long ago, Hermes was saying that with research and everything, like people who get micro penis are gonna get better help, and that will be optimal. Would you, if we could do a lot of research so that everybody is raised to become like to get like to not grow out to be like trans or gay, like if we could find a way to like having people grow up and everybody is straight, would you like, is that something you would look for, like if it was possible and without harming anyone, obviously, just like with transition or whatever, if that makes sense?
Yeah, I understand your point. So you point out without harm. So I'll give my take for with harm and without harm. So we do know that what is that called? Shit, I forgot. There's this thing done, especially in like Christian Christ camps or whatever, but it's to get people that are gay or whatever and try to make them straight. I forgot what that was called, but it's banned in most countries. And
Conversion therapy.
Conversion therapy, thank you. And it's considered highly unethical due to the damage that it has. But let's say we had a magic button and that would go away. Do I think we should still do it then? I would say most likely no. I mean, I don't think it's necessarily a bad thing. If there was a magic button I would have, it would be so that the transition happens perfectly. Because at the end of the day, I believe in the ideals of the pursuit of happiness and pursuing your dreams and being who the fuck you want to be in the United States. So the idea of kind of deleting the dreams or the desires or the identity of a person in order to conform is incredibly dystopian, for one. And I mean, it's not even addressing. Yeah, that's it. I just think it's really dystopian for one.
To have everybody be only like straight and that's it.
Yeah, if you're like so if someone wants to be let's say a pilot, but you're like pilots have like a 5% chance of having an accident, you're like, well, you know what, let's instead of making them better pilots, let's just make sure they don't ever become pilots by pushing this button. So in that sense I
But
would say no.
but how is that, like, your dream is not supposed to become like a trend? Like your dream, I mean, it can be, but it's like,
It's more than a dream, actually. In this case, it's more like who you are. So, like, let's just say someone is like a 5-year-old astronaut, and they are an astronaut. Like, they know they're going to be an astronaut, and they will pursue it till the day they're like 7 years old. They've made their mind. Now, this is a very rare example that I'm giving, but it's just to highlight the point that, sure, you could say that it can bring about a lot of difficulties. It can be unrealistic, blah 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 blah. Blah. But the way that I go about it is to provide support, for the person that wants to be an astronaut, rather than saying, no, you got to be normal, be like everyone else.
no,
So
but I mean, I don't think it's a right comparison, because like he can still become an astronaut if he's like straight. I don't really understand, like
no, that the point is that
like
the
what's the
identity
betterment for?
is who they are, and you're basically saying delete who they are and
No,
basically
not at
reduce. No,
all.
no, no. Please let me just say and then respond. I could be
Sorry.
wrong, but please let me finish. So the idea is to basically push a button and brush the entire society with one type of expression, which I mean, from an also evolutionary perspective, I would say that's less diversity is always more damaging, and also there with the population increasing as it is, at this stage, I think gay people are actually a greater net positive than straight people in general, and places like I would say everywhere in the world needs a lot more gay people actually, in general. But um, yeah, that was it.
So I mean, I don't. What I'm saying is like people, your identity, who you are. You grew. I'm not saying people who already are trans, you switch them up. I'm saying if we found a way so that people growing up never become like just the way the way we raise people. Like if we found a way so that they never become trans, raised that way, and they're normal human being, they're not fucked up for life because we traumatize them in some like, we're really talking just weird. If that was possible, you don't think it would be preferable?
So if we're trying to invoke this magic no harm thing, because conversion therapy is harmful, we know that the
No,
reality
I'm
is
not
it's
saying.
harmful. So we're saying that there's this button that we press, and all of a sudden, all the children growing up will grow up to be quote unquote normal people, and this obviously would be something someone would choose if they thought there was something wrong with being not straight, because this is basically saying it's an undesirable thing, and therefore, if you have the option, would you take it if you could remove it? I sincerely disagree with your take that it's an undesirable trait. And so keep in mind the majority of people that have gender dysphoria and are transgender or whatever don't commit suicide. The goal is to lower that number, not to remove their, indoctrinate them out of their who they are, basically.
I understand that, but you're not understanding what I'm asking to begin with. I'm not sending the the kids to a conversion therapy. He just never expressed the feeling of wanting to become trans in the first place, and we found a way to raise kids that no kids ever want to become like or not to become like, they aren't growing up like that. Like, yeah, I guess becoming gay, because I do believe that you can raise kids to be whatever. Like if you raise kids saying it's really okay to just have sex with everybody, and you can, I believe you can mold people in like, people are really malleable when they're young. You can like raise people in multiple ways. Like you can raise people praying crazy shit, and if everybody around them, like if this like all the kids around them, they all grow up the same way, they all praise this crazy god, whatever, they'll do it, and it's gonna be normal for them. Like we can really, I don't know. I think we can mess with people's brain when they're growing up. I don't think born this way is like a real thing, and I don't think it's real either for necessarily straight. Like I think you can really, like, yeah, it can be really malleable. I don't even think straight or what. Like I think it's just the way people grow up to be like in society. The way we. Sorry, I'm really butchering this. This is awful, but I think you get the gist of it, right?
Yeah, I did get the gist of it. Basically, by the way you grow children up, how you what you expose them as they're growing up to as a child, you can grow them into being straight. Now, here's an interesting example that is actually brought up by a lot of people that want to say being trans doesn't work. There is this example, and this was actually brought up by Ben Shapiro to debunk trans people, which is funny because it actually supports the trans argument. But so there was this boy. I don't exactly remember what happened, but for some medical reason or something of that nature, I think. I'm not sure what the reason was. Regardless, the parents decided to forcefully raise that child as a girl. And that kid, I think, ended up killing themselves. But this actually is proof that that person, like raising someone as another sex, they don't have the dysphoria, doesn't work. Dysphoria is necessary, and there's a vast amount of literature between the prenatal um, hormone exposure that can lead to differences in characteristics and behavior, and differences between gray matter and white matter in the brain, and many other stuff. I mean, I don't have the details right now with me because I didn't prepare the brain thing yet, but maybe next time.
Sure. I mean, um, I know about the guy you're talking about, like this study. It's not really a study, but just the case of this guy who's been raised like a girl. But the thing is, at the time, was really not fashionable to do that. Like like he was very unhappy because everybody was rejecting him and all that stuff. Like, because he felt he was really different, and like I know which case you're talking about. And basically, if society was right, we're pushing right now like all accepting of everything, and like have supported him and everything, like he would have probably not killed himself, you know, if yeah, he was being supported, but he was clearly seeing himself as a freak, and like for sure he was, because at the time it wasn't common at all, like as it is now. Like now you can see it on fucking TV show for kids, transgender people chanting stuff. So like I
And we
do
have straight
think,
people chanting too. Just
yeah, but that's my I said, like we're talking about social contagion, like about this is becoming a trend. People are doing. Sorry, I was receiving a phone call. But yeah, people becoming more and more like, some doing it because it's like they want to rebel, some doing it because they feel that way. Some, I do believe it becomes part of your identity. If the from the age of 7 you're starting to say like, oh yeah, I'm a girl, I identify as a girl and everything, it's gonna become part of your identity for real. It's like, if it's like with the whole Fury thing, kids who are like, oh, I'm a fox, I feel like a oh shit, sorry, I gotta go, I'll be right.
all right. Yeah.
All right. Well, does anyone have any more questions for either Hermes or Shogun?
I think I just want to
Hello.
thank. Yeah, go ahead. No, okay.
Yes, I have a
wanna
question.
Someone have a question?
Yes, I have a question.
Go ahead, Ben. Go ahead, Gain. You're breaking in and out, and
Okay.
yeah, go ahead.
Okay. Can you hear me now?
Yeah, go ahead.
Okay. How feasible would it be for half of my body to be female and the other half male? You know, because sometimes, you know, I'm not feeling so butch, and you know, sometimes I don't want to deal with the emotional ups and downs that come with femininity. So, you know, I think taking advantage of the best of both worlds would be a very practical step to take, don't you? So, yeah, if I could just split half my body, one would be female, the other male. So, yeah, how feasible would that be?
I mean, scientifically, it wouldn't be feasible. If you have a broader kind of rhetorical point, you want to maybe just make it more explicit. I feel like this is a question that probably has a point, so maybe just get to the point that you're trying to make with it.
I would like to just respond real quick though. There is actually a condition where you can have different DNA in the same body, and it's really weird. So I guess technically it might be possible. Although the thing that you're talking about switching, I think that's technically non-binary. I think I'm not entirely sure. I'm not really well versed in it, but the idea of doing it because it's socially advantageous is assuming bad intent on those individuals. Also, the advantages that people have in these categories is vastly disproportional to the problems that are associated with it. I know there's this idea that if you're trans, your life is going to be perfect and everybody's going to accept you, but yeah, I'm pretty sure that's blown out of proportion.
So
Right,
I'm
but
gonna stop you there again. I think it's almost time to wrap up, and I don't really think there's a lot of meat on the bone of that question, to be perfectly honest. But we can get into
insulting.
we can get into further debates along these topics, and I'd like to do that in further conversations. But I'd like to wrap up because I'm going to run out of battery, and this has been a pretty good conversation. So again, I just want to thank the moderator. I want to thank my opponent, Hermes, and thank the audience and the recorder, Rafi. The moderator was Lava. You did a great job. As for the results of the polls, you guys can check. It looks like the large majority of people agreed with my position. However, the breakdown of who people felt did better as debaters was more or less neck and neck. So, yeah, that's the result of that. Again, there are no winners or losers. It's just for you guys to consider. So thank you, Hermes. Thanks, everybody. And this will be up on the RT Podcast channel in the next day or two, as well as a bunch of other great episodes. And tomorrow at 8, we have Elder Thoth of the Library of Alexandria server returning to talk about Hermeticism, alchemy, magic, the occult. So don't miss that. That's at 8 p.m. And please join the Roundtable Discord server. Thanks, everybody. And maybe let's jump up to Roundtable chat now.